Sun Life Financial is proud to host this roundtable on healthy workplace cultures in partnership with the HR Reporter. It's part of our thought leadership platform, The Conversation, which brings together leaders and experts to deliver the best thinking in group benefits both inside and outside our organization.
With an aging population and persistent levels of obesity, Canada is seeing rising levels of diabetes. More than 20 people are diagnosed with the disease every hour of every day, according to the Canadian Diabetes Association. And the costs for treatment are considerable, with employers reporting sizable drug bills, along with issues around absenteeism, disability leaves, and performance. Canadian HR Reporter recently moderated a roundtable, sponsored by Sun Life Financial, that brought together several experts to discuss the challenges of the disease and possible solutions. In this video, the third of a three-part series, panelists talk about the cost of diabetes in the workplace, particularly when it comes to drug costs and issues around absenteeism, presenteeism, and disability leaves.
For us, it's we know this is a current existing national problem from our perspective, whereas the last probably 5 to 7 quarters, it's consistently been our highest drug use. So of course it's all covered under privacy. I don't know whether or not it's direct employees versus their spouses' dependents on our plan, but we are aware that diabetes drugs are our highest use of any single drug nationally for the last, almost 2 years. And if we don't start doing things such as education, prevention, maintenance, this can only get worse.
The costs for diabetes are high, and that's why prevention is so important. We know that an employee with diabetes costs about 4 times the cost of drug therapy for a person who doesn't have diabetes, and so that's quite significant. Costs also occur in terms of presenteeism and absenteeism and short-term disability. So there are costs to the employer for sure. Why the costs are so much? In part because the population is growing, and the demographics of the population are such that I think that, like we've said, the incidence of diabetes will continue to grow. So the impact on the drug costs will increase over time. And I think that we do have an opportunity as more and more people to go into that pre-diabetes state and have multiple risk factors to bend the curve, as we say, to reduce those costs from what could be or what the projected costs could be going forward.
I think that the training piece is a fabulous opportunity. When you sensitize your people, your managers, to things that might be going on in your workforce, then conversations are had. And we're not trying to create physicians. We're not trying to create counselors out of our managers. We're simply trying to have a conversation that says, is there something going on here? Is there something we can do to help you? Is there a way that we can direct you?
A lot of organizations are missing very key marks that are very easy to put into place, that are that are very inexpensive, and most of it is around prevention, maintenance, education. And the one thing that we did, which probably saved our plan over 9 years ago, was do a generic mandatory, which is a critical illness from an organizational perspective when the drug costs of everything, not just diabetes, are overrun. If we didn't have that generic mandatory, I couldn't even imagine what the costs of our drug usage would be like. And I think the other key point, as you were saying, is really it's a wellness issue from an organizational perspective. Organizations who aren't focused on, health and safety is one piece, but if we're not focused on wellness and things as simple of partnering with someone like a CDA, even getting the collateral or information into our employees' hands, I think we're doing a very disservice to our employees.
Well, most people who have diabetes have type 2 diabetes, 95%, I think you mentioned. So there's a lot you can do from an educational perspective, seminars, wellness fairs, webinars that we have at Soft Choice. In addition to that, also a fitness center or even fitness challenges, Biggest Loser, going for a walk at your meeting instead of sitting at your desk all day, just kind of getting yourself moving. I know we have standing stations at your desk where you don't have to sit down the whole day as well. Just kind of getting people moving, as well as promoting a healthy lifestyle. So bulletins on nutrition. What are you eating? Do you know what's on the labels of your food, right? Some people just eat whatever's available. I have 5 minutes, let's grab, Tim Hortons muffin? Do you actually know how many calories are in that? So I think that's a huge opportunity. And I think $3, I read online that $3 spent in drug costs for what you can spend $1 in wellness, and that will save $3 in drug costs. So there's a huge opportunity. The only disadvantage is long term, right? So you can invest $1 today in wellness, but you won't see the return for another like 5 to 10 years. So I think there's still some uncertainty around the actual metrics and ROI, but definitely a huge opportunity for employers.
I think we also need to ask employers to be a little bit strategic and innovative, even with respect to thinking about drug costs. So, for example, we know that some of the psychiatric medications are, I think one of them I'm thinking of, I think the numbers are for every 4 prescriptions written, your chances of causing significant weight gain and type 2 diabetes. So it's 4 to 1. So we need employers to think about how the medications they're covering for the treatment of mental illness are going to impact the coverage of medications for the treatment of diabetes.
Of course, people behave within the broader context of where they live. And so if you're in a workplace that offers healthy options or only offers healthy foods, that's what you will consume. If there's vending machines everywhere and you're on a quick break, that's what you'll consume. If you're in a peer group that doesn't exercise or doesn't take regular breaks, that's what you will do. So it is really normalizing health behaviors that I think that will win in this battle that we're having, and trying to change our social norms.
I get that question actually all the time from my employer clients that say, we know this person is not taking their medication. They are not helping themselves in the accommodation that we are offering. What can we do? And to harken back a little bit, David, to one of the comments that you made earlier about, we want to train people, but we don't want to make them physicians. We can't do that. And I find there's a tendency sort of in the HR community to overreach a little bit, to sort of try to be that extra supportive, wonderful manager, but they're not a doctor. And I'm often clawing people back saying, hold on a second. Please direct them to the resources that are available, the external stuff, whether it's an EAP, whether it's their doctor, whether it's someone else that can actually really truly help these individuals, as opposed to you sort of inserting yourself in there as being the help resource, because you're not qualified to do that. And sort of extricate, train enough to understand what the signs, symptoms, and so on, and when someone needs the help, and then get them that help.
If we take weight and we reduce it by 5% in an individual, the fact that we can reduce their risk of prediabetes going on to diabetes by about 60%,
Absolutely.
by just reducing weight by 5%, that's not a number that's widely known. That's
right.
something we have to share. And if we roll that forward in terms of massive reduction in risk, think about presenteeism, absenteeism, drug spend, LTD, STD, EAP, all of these things that become that huge spend for large corporations, medium-sized corporations.
Absolutely.
All of a sudden, there's your business case, and it's like away we go.
I think part of it is destigmatizing it, like you mentioned, and also motivating people. So the apps are great, like MyFitnessPal integrates with the pedometers, like Fitbits, and just motivating people. Hey, how many steps did you have today? And just getting people encouraged to kind of do something about it, because people feel insecure about their own weight, about their own disabilities or health issues. And also just raising awareness about like how risky it is if you don't treat it. So you can actually end up on LTD. You can risk blindness. You can risk like an amputation of a limb if you don't actually treat diabetes early. So I think it's just continuing to remind people on the awareness side and then motivating them.